Welcome everyone again. My name is Arina Tamborska. I'm a neurologist and a public health professional based at the T.H. Chan School of Public Health at the Harvard University. And I'm also affiliated with the University of Liverpool, which is our organization which has been co-hosting and funding this brain health exchange platform for the last 3 years. We are excited to have a great chair and 2 speakers joining us today. I will start with a little bit of the housekeeping, and then I'll pass on to our chair, Professor Mayowa Ojo OWOLABI, to introduce our speakers and also the topic of today's platform. In terms of the housekeeping, we are being recorded. Your camera and your microphone will be turned off. Please use chat function to ask any questions during the presentation. We'll have 2 speakers first present, and then we'll tackle all questions at the end of the presentations. And then you will also have a chance to come on live on Zoom with a microphone on in this final part of the discussion to ask your questions as well and connect with our audience. Please do stay till the end with us, because we'll have the opportunities section, as we always do in these presentations. And we have some very exciting announcements to make on this session in particular, especially about upcoming competition, as well as usual about great funding opportunities and fellowships as well. So please make sure you don't leave early. But if you have to, we are being recorded, and you can watch all the sessions, including this one, on demand from our website, which we'll put in the chat shortly as well. These are the registrations for our sessions. So we have participants joining from all over the world. We are excited to have you here with us. And now I'm going to introduce our chair. So Professor Mayowa Ojo OWOLABI is a professor of neurology at the University of Ibadan in Nigeria, and he also is a director of the Center of Genomic Medicine at that university. He is a really well-published scientist and researcher, and I've had real trouble shortening his biography to just under a couple of minutes. He's published about 250 scientific manuscripts, mostly on the topics of brain health, neurology, and also implementation science, but with particular focus and expertise in stroke, hypertension, and cardiovascular disorders. Professor OWOLABI is a primary investigator of multiple stroke trials on the African continent, including the largest surveillance studies and the largest study recruiting stroke participants and looking at their genomics as well. With that, he also serves as a member of multiple boards. He is a co-founder and a vice president of the of the Federation of Neurorehabilitation. He serves on the board of the Global Lancet Commission for Non-Communicable Diseases, for stroke, and also on the expert board for WHO for non-communicable diseases. And he is also on the board of the World Federation of Neurology, and also on the World Federation for Hypertension. So multiple functions. Great advocate for neurological diseases, truly dedicated to the cause. So I'm really glad he's joining us today to be chairing this session. So Mayowa, thank you for being with us, and over to you to introduce our session and our speakers.
Thank you very much. Just to say that this is an extremely important topic, and that is because neurological conditions are the leading cause of disability across the globe, and the second leading cause of death. Just picking just one of them, which is stroke, it costs, from the Lancet Commission work, we found that it costs at least $1 trillion every year, and this is likely to increase. Dementia costs over $1 trillion every year. The leading conditions, of course, are...
Hello?
Hello, can you hear me?
Sir, yes, sir. Sir, the text that are, guys are texting so much which are so disturbing.
Hello? There's some noise in the background. Okay, yes, let me just go on. If you can hear me, I'll just go on very, very quickly. So this is going to be addressed in detail by the speakers, but these are the spectrum of conditions from stroke all the way to motor neuron disease. And this is the latest one from the GBD. And spectrum across the life course with stroke and dementia towards the tail end. And again, we are sparking a neurology revolution. And advocacy is very, very vital to really making sure that this neurology revolution comes on board and putting brain health at the center of everything that we do. Brain health is central to physical, mental, social, and well-being. Of course, everyday life, not just looking at dementia, but eumentia and supermentia. The Intersectoral Global Action Plan is what has really helped to usher in this revolution. And it's important for us, therefore, to put brain health at the center of health. Without brain health, there is no health. And without health, there is no SDG. These are all the SDGs. And this is the entire paradigm, including physical, brain health, social health. They are all interrelated, particularly in a world where knowledge economy and brain economy is very vital, and brain capital, of course, and is an ecosystem that includes advocates who serves like commissioners, so to speak, or ambassadors. And we must work with everybody: providers, practitioners, physicians, policymakers, patients, caregivers, their families, payers, funders, general population, and of course, government and intergovernmental agencies. And we must look at not just prevention, but also surveillance, research, treatment, acute care, rehabilitation, and of course, health system engineering. So on these notes, I want to thank everyone who is participating, and particularly the speakers. And I will now introduce the first speaker, who is Justin. Justin Jordan, Dr. Jordan's clinical who is an associate professor of neurology from Harvard Medical School. Dr. Jordan's clinical interests in primary nervous system tumors, neurofibromatosis type 1, schwannomatosis. His research interests are in the identification and targeted treatment of molecular drivers of tumor formation. He's a leader in defining and measuring quality care across multiple diseases in neuro-oncology space. And he serves as the vice chair of the American Academy of Neurology Health Policy Subcommittee, and as a member of the AAN's Brain Health Committee. He leads the AAN's Palatusi Advocacy Leadership Forum in 2023, and currently is serving on board of directors for 2 large disease-specific advocacy organizations. So we are lucky to have Dr. Justin Jordan, who is very, very passionate about advocating for brain health, which is very vital to everything that we do as human beings. You're most welcome.
Thank you so much for the invitation to join today, and also for that kind introduction. So I'm excited to be here to talk to you today about really the intersection between research and policy and in our promotion of brain health. So as we just heard, the global burden of neurologic disease is tremendous and demands action. The WHO study just showed that nearly 1 in 3 individuals in the world is affected by neurologic disorders. And in fact, neurologic disorders are the leading cause of illness and disability worldwide, as well as one of the leading causes of death worldwide. So we absolutely must act now with purpose. And optimizing brain health is not only to individual health, but really it's a moral imperative across the globe. And so it is the case that patients with neurological disorders are at risk of discrimination, of stigma, of poverty, of reduced quality of life. And as we already know, many neurologic disorders are preventable, and really all are treatable, whether or not, and some curable. And so lastly, marginalized people, marginalized and underserved populations are particularly vulnerable to many of these neurologic diseases. So as we begin to think about opportunities for advocacy, it's important for us to keep in mind this is valuable politically, this is valuable financially, this is valuable ethically and morally. So depending on the stakeholder population we're addressing, there is absolute critical need and value in promoting brain health. We've heard about the Intersectoral Global Action Plan on Epilepsy and Other Neurologic Disorders, published in 2023. This is really a comprehensive plan put out by the WHO and adopted by member states to look at the global burden of neurologic disease and ultimately reduce that burden. And most pertinent to us today, priority number 1 in that IGAP is to raise policy prioritization and strengthen governance. So the WHO really understands the tremendous importance of prioritizing advocacy in this space and working with stakeholders, including policymakers. So the IGAP really emphasizes the importance of evidence-based decision-making, which we'll talk about here in a moment, as well as the critical need for working across various stakeholder groups to make sure that we're focusing on equitable, sustainable, and culturally appropriate interventions as we move forward in ways to optimize brain health. So we have a quick poll for you that I want to ask to be launched here. Great. So 70% of, so which of the following requires advancing policies for brain health? About 10% of people said incidence. About 20% of people said data supporting effectiveness of proposed intervention. 1% of people said individual patient stories. Nobody said stakeholder buy-in is required, but 70% of people said all of the above. So that's very helpful sort of background. I'm going to go back to sharing my screen now and show you that really translating science into public policy is critical for a variety of reasons. First of all, it promotes decisions grounded in evidence and data-driven analysis, which I think is critical when we're making decisions that impact people's lives. Being scientific in our policymaking offers opportunities for targeted interventions to achieve brain health goals. It contributes to economic growth by driving entrepreneurship and technological advancements, which we believe and understand the science backing those. And then probably most importantly, when we're scientific in our policy making, we increase transparency and accountability through government institutions when we can reliably report back to our stakeholders why we're doing what we're doing. And so stakeholder voices are absolutely critical. You need buy-in from everybody. And it's important to remember that not every stakeholder stands to benefit from a given public health measure, but it's important to hear voices even of dissenters. When we begin to think about structural and social determinants of brain health, it's so critical to look at stakeholder populations, even who may be marginalized. And also keep in mind that tensions may be higher when we're thinking about lifestyle and habits as a potential intervention. Those are critical for us to focus on in terms of brain health, but the road may be harder. You may need more voices for that change. And then as you're trying to move forward an idea that may improve brain health, it's important to prioritize those essential aspects versus those that are ideal. On the right, you can see a grid of the influence of stakeholders compared to their interest in the topic. And so it's really critical to think about those two aspects of individual stakeholder groups to identify who is most likely to help, who's most likely to sort of argue against you, and who actually has a stake in the discussion that you're having. Advocacy successes are not at all linear. And so it's really critical to think about the various pieces that can play into that. So obviously there are political and economic constraints at any given time. And those may sometimes feel like a hindrance, but it's also important to keep in mind where they might actually be beneficial for you. If there is a political moment that's focused on something adjacent to brain health, can you find stakeholders in that population and lean in there, for instance? Communication between researchers and policymakers is sometimes not easy. Scientists speak one language, policymakers speak another. And so all of you on the call hopefully are here and understand that really there's a linchpin there. And I think that people in the public health and the medical space can and should be communicating very clearly with policymakers. Public opinion certainly plays a role, especially in democratic societies where policymakers are trying to get elected again. Political turnover as people lose offices and move on to other jobs. If you've developed relationships that over the years and then suddenly your relationship is out of that office, that can slow things down. And then lastly, the strength of supporting data. We have a growing amount of evidence for brain health and ways to prevent and recover brain health, but there still are huge gaps in our knowledge, and that will play a role in this as well. So the ingredients to advocacy success pertinent to the poll we had really objective measures of current disease burden are critical, and we have some really wonderful publications in many spaces now to help with that. Analysis of potential benefit of proposed interventions. And so if you think that you have a way to reduce stroke through focus on hypertension, for instance, publishing that intervention and it is going to be incredibly helpful. Input from all stakeholders, if possible, or as many as possible, I should say. Individual stories. And so, really depending on the audience you're talking to, it is often an individual patient story or a group of patient stories that really may push a policymaker into understanding the true aspects of what you're talking about, or may provide them the soundbite that they need to go back to their other supporters and be able to vote in favor, for instance, of something you're advocating for. You need trust in the system, in your stakeholders, in your policymakers. You need to develop those relationships. And finally, you need persistence. So I'm going to end with what can you do now? Where can you begin? I think it's helpful really to familiarize yourself with the components of the WHO IGAP. That we started talking about at the beginning. It's critical to understand the framework that member states, including probably the country that you're living in, have signed on to as a way to focus on brain health. Identify areas of particular interest for you. We can't all take on brain health as a whole, but if your focus is on brain tumors, for instance, that gives you a more narrow lens to think about how can I improve the life of individuals with brain tumors. Building a relationship with stakeholders and policymakers is something that you can begin today. And I would love to talk about that sort of further. Aligning with larger organizations who are also focused in brain health. Public awareness campaigns. Many of you, everybody in the health space is so good at communicating with patients and family members. And so building those into awareness campaigns, I think, is critical. Contributing to research, for those of you who are involved in research, will help bolster the supporting data. And then lastly, communicating evidence behind policy recommendations for that transparent exchange of ideas and goals. And I'm going to stop there. I'm very happy to take questions at the end of this. So thank you very much.
Yeah, thank you. Thank you very much. So we quickly now take Mr. Sam Mountney. Please, you can put up your slides. Sam Mountney will be talking about the Neuro Task Force and the new economic report that was just released. So, Mr. Sam Mountney, is the external affairs manager of the Neurological Alliance. Neurological Alliance is England's largest coalition of over 90 neurological advocacy organizations. And Sam has been leading this. Sam led the delivery of my neuro survey, the largest national neurological patient experience survey in the UK. And he was previously seconded to National Voices, the leading intersection of health policy and the practice of medicine. He chairs the Board of Health in his local government, runs the Center for Health Policy and Advocacy within the Department of Neurology at Massachusetts General Hospital, serves as vice chair, the American Academy of Neurology. Mr. Sam Mountney, you have the floor.
Thank you, Mayowa. Brilliant to be here today. And thank you very much, Justin, for your presentation. I thought it was fantastic. Really pleased to be joined by colleagues from across the world. And I hope that my presentation will provide a couple of practical examples of delivering on some of the points Justin made in his presentation. Next slide, please. So firstly, a bit of context as to who we are. The Neurological Alliance is a coalition of more than 90 member organisations, all with a common aim of improving treatment, care and support for people affected by neurological conditions. We specifically work in England, but we also collaborate with similar alliances across the UK and internationally, which I'll speak a bit more about as the presentation goes on. So our members are mostly charities, but they also include professional bodies, including the Association of British Neurologists, bringing together all the key stakeholders in the space in England to advocate for improvements to treatment, care and support. We do this in three key ways. We foster collaboration. We generate robust data and evidence, and we work together to advocate for improvements in public policy. All three of these are critical to successful advocacy work and will form the basis of my presentation today. The gentleman on this slide, I'll introduce him quickly. His name's Reese, member of our co-production group and a fantastic advocate for people affected by neurological conditions. Next slide, please. So the first rule of good advocacy, from my perspective, is good data and evidence. I think that was a point made by Justin as well. And for us, a vital source of this is our National Neurological Patient Experience Survey, we also call My Neuro Survey. It's the largest survey of its kind in the UK and captures the experiences of our community, identifying what is working well and crucially highlighting any key challenges. We've run the survey every couple of years now since 2014, most recently in 2021-22. And for the first time, the survey was UK-wide in collaboration with colleagues in Scotland, Wales and Northern Ireland, and included a version specifically for children and young people. So taken together, it meant that the survey was open to anyone with or with a suspected neurological condition in the country, ensuring parity of access to the survey. We received over 8,500 responses, providing a really robust data set to inform and underpin our advocacy work, both nationally and also at a local level with local health systems. Next slide, please. This is my first poll, a quick poll, if you wouldn't mind. So we know from speaking to our members and listening to our community that mental health and well-being is often a key challenge for people affected by neurological conditions. For many, being able to access appropriate mental health well-being support is vital. This short poll provides an opportunity for you to consider how many people you think told us that their mental well-being needs were not being met in response to My Neuro Survey. I should add that we think supporting anecdotal evidence with robust patient experience data is a really vital part of successful advocacy work. And this indicates a way that we can do that through gathering patient experience data and insights. Very good. A really interesting mix of responses there. So the correct answer was over 2/3. So it was C. 67% of respondents told us their mental well-being needs were not being met, demonstrating a need for improvements in access to mental health and well-being support. So next, I'll talk you through how we use the findings from the survey to try and tackle some of the key challenges facing our community. Next slide, please. Another important aspect of successful advocacy is collaboration. As a membership organisation, collaboration is at the heart of everything that we do. So we use the findings from the survey, work with our members, and crucially with people affected by neurological conditions to co-create a campaign, which we termed back the 1 in 6. The name was devised by our co-production group and refers to the prevalence of neurological conditions in the UK, a really important statistic that we thought was underrepresented and not well known within the UK or by decision makers. For too long, neurological conditions have been at the bottom of the list of political priorities in the UK, and I'm sure this is the case in other countries internationally as well. So this campaign was attempting to change this. So we were calling for what we called a neuro task force to be set up by UK governments, providing a national framework to improve treatment, care and support. It was vital to show the level of public support for the campaign. So we set up a petition, and in a couple of months, we gathered over 19,000 supporters, and over 100 organisations also backed our cause. So strength in numbers, we thought it's an important part of advocacy. The petition was submitted to the Department of Health in June 2023, together with people affected by neurological conditions. We also hosted an event in the UK Parliament to speak to parliamentarians and decision makers about the campaign and about our calls for a task force. We met over 20 MPs, and the topic was debated in the House of Lords, the second chamber in the UK Parliament, raising the profile of this issue amongst decision makers. We also worked alongside our community at every stage of the campaign, a really critical part of our success in this advocacy approach. More than 300 people shared their pictures to form the image on the slide here. Over 1,300 people invited their members of Parliament to attend our event. We worked with our community to share their experiences with the media, with over 40 pieces of coverage, highlighting some personal lived experience of living with a neurological condition. Next slide, please. Second poll. Patient experience insights are a key driver for successful advocacy, but being able to make an economic case for change is often similarly vital, particularly when engaging with government. One of our industry partners, Roche, worked with the Economist Impact Unit to research the economic impact of neurological conditions in the UK. I'm very interested to see what you think the estimated economic impact of neurological conditions in the UK was in 2019. So if you wouldn't mind completing this short poll, I'd be very grateful. Brilliant, thank you. Really interesting spread of responses there. The total was £96 billion. So yeah, a huge number. It equates 4.3% of GDP. So now, alongside using this research, alongside our patient experience insights, we now have a strong economic case for change, as well as knowing it's the right thing to do through conversations with our community. Next slide, please. So this is the report that was published. As far as we're aware, this is the first time data of this kind of been produced for the UK. The report also referenced our calls for a neuro task force, deeming it necessary to provide the strategic direction to improve treatment care and support. The report also estimated the potential savings associated with universal rollout of existing interventions, and they put that cost saving at potentially £30.8 billion. Improving services and saving money seems like a win-win to me, and that's the case it will continue to make to government. Building a strong evidence base, combining patient experience insights with an economic case for change has strengthened our calls for action. Next slide, please. So given today's global audience, I thought it'd be helpful to briefly speak about some of the areas we collaborate on internationally. I know the IGAP has been referenced, and unsurprisingly, we're very supportive of the action plan, and we're engaging with the Department of Health and Social Care here in the UK to respond to the IGAP. Our Back the 1 in 6 campaign has made it halfway around the world, and has come to the attention of colleagues in Australia and New Zealand, who are now exploring the possibility of running a similar campaign in their countries. We're also expanding the reach of My Neuro Survey, with the next iteration also being available to people in the Republic of Ireland, together with colleagues in the Irish Neurological Alliance. And we've recently joined the European Federation of Neurological Associations and supported Brain Awareness Week here in the UK. So international collaboration is really vital to what we do, and we hope to do more of it going forward. Next slide, please. When it comes to advocacy, there is always more to do. So this slide provides a snapshot of the work we have planned over the next year. We'll be calling on MPs and political parties in the UK to back the 1 in 6 during the UK general election, a really important opportunity to influence and advocate for change. We're continuing to generate new data and evidence with the next version of My Neuro Survey going live this summer. And we'll be developing new partnerships, including being here today. So we're a tiny team, but you don't need many people. All you need is a lot of good collaborators, and working together with people affected by neurological conditions and the wider neurological community can really help you punch above your weight when it comes to advocacy in this space. Thank you for listening. Really looking forward to our discussion, and I'll end my presentation there.
Yeah, thank you very much. So we have about 15 minutes for discussion. I think that's actually the most important part of this session. So thank you so much, Justin and Sam Mountney, for your very brilliant talks and for highlighting the main issues about advocacy. Advocacy requires communication, and communication is extremely essential. And like Justin mentioned, usually is a tortuous road, is a meander, is not a straight line. It's important for science and policy to intersect. And for that to happen, communication must occur. And that means that we have to speak the language of the politicians in terms of what is the political gain for it? You know, what is the economic gain, economic case, as Sam Mountney illustrated for the UK? What is the economic case, the political case? All of these are very, very important. And essentially, it's also very, very critical to bring all stakeholders on board. And the more the people who are brought on board, in terms of spectrum, in terms of spread and commitment, the better. I think those are very, very, very important and vital lessons. It's also very important while trying to find out what needs to be done to involve the people. And that is why the survey that was done in the UK was very, very, very important and very, very instructive. And with over 100 organizations as mobilizers. Truth of the matter is, if something involves 1 out of every 3 people are going to have neurological conditions and disorders. And the remaining 2 out of 3 are at risk. So it's everybody's business. So if you are going to deal with something that affects millions and billions of population, then the higher the number of people and the more diverse those people are, the better for them. So it's extremely important, as has been mentioned, not to think only in terms of rehabilitation or recovery, but also think very strongly about acute care, think very, very importantly about prevention and promotion, and think also about surveillance. in order to be able to monitor the burden of disease. So I think those are the key issues. And I think there are a few questions already waiting to be asked. I would maybe allow a few people who have raised their hands to speak, and then I will also ask some questions, and then of course we will go through the questions that are in the chat box. So I think I saw one hand up. Okay. All right. Okay, maybe I should start. Okay, that is Mansoor Ahmad, you wanted to make some comments? You want to make some comments?
Yes,
Mansoor?
yes,
Okay.
sir.
Very briefly. Yes.
Sir, what are the major causes of neurological disease that which we interact with daily life?
What's the question again? You said, what's the major cause of neurological disease that we deal with in everyday life? Was that the question?
Yes.
Oh,
Yes,
excellent. So, using the GBD data, it looks like stroke is the second leading cause of death, and is actually the leading cause of neurological disability. Following very, very closely, of course, things like dementia, like headache disorders are really very common, and of course, epilepsy. Even though the Intersectoral Global Action Plan is against epilepsy and other neurological conditions, but actually, if you look using burden of disease, I think stroke and dementia and headache disorders are even more common than epilepsy. But they are all very, very important. But the lucky thing is that the fortunate part of that is that many of the risk factors for stroke are also shared by dementia. And so when you are preventing stroke, you're also preventing dementia by dealing with vascular risk factors. So many things that we do for one condition actually can help in terms of healthy living, healthy lifestyle can also help with others. So I think if I'm going to ask one very quick question, I would ask Justin and Sam to talk about the importance of intersectoral collaboration. And let me illustrate. If you really want people to live a healthy lifestyle, like for instance, we know that 60 to 70% of the burden of stroke is due to lifestyle factors. And there are social and economic determinants and commercial determinants of health. So, and if you really want to deal with this across the life course, you need to involve the educational sector. You probably also need to involve the agricultural sector in terms of the food value chain. And you, of course, also have to work with legislators like Sam did, with the legal system. And that has to do with dealing with controlling harmful exposures like air pollution, like unhealthy diets, fatty food, cigarettes, alcohol, and substance abuse. All of these have impact for brain health and, of course, for mental health. In dealing with this, so that sector is also involved. Of course, the economic sector is involved in planning, in saying, oh, this is a disease that costs trillions of dollars. We need to put in $20 billion every year to prevent it and things like that. So almost all the sectors are involved. To what extent are we able to engage, and what tools do we really need to ensure that we are engaging all the important sectors in the society? Thank you very much. Justin,
I'm happy
you want to take it for Sam? Yeah.
Sure, I'm happy to start. Yeah. So you raise such a critical point, which is that really every part of the world of society touches brain health. And I think that from the outset, as you described it, it can feel overwhelming. We have to involve every sector, and that where do I start is sort of the big question. So I think as I sort of pointed out, identifying your area of interest and starting small is going to be critical. Every small win is a win. And so if you have colleagues, friends, family, expertise yourself in the agricultural sector, certainly you can start in a big way in looking at federal or state level access to healthy foods. But it's also important to remember that local advocacy can often be a training ground for bigger advocacy. So in your own city, if you can identify ways to have farmers markets with increased fruits and vegetables that give access to people who would otherwise not be able to have those healthy foods, you can study that. You can help build it, study that, and then show it to your state or show it to a bigger area to identify the downstream benefit. And that's sort of the stepwise approach that I would think about in looking at intersectoral work.
Yeah. Sam, you want to give some examples?
Thank you. I would totally agree with what Justin said there. I think it's a kind of national political level. I think we hear quite a lot in the UK about well, I want to hear more of a health in all policies approach, and I think it's also the case for a brain health in all policies approach. So it's, as you said, it's not just health and social care, which is obviously very important, but it's actually other areas. Not least things like housing, things like the economic cases, as I mentioned in my presentation as well. So I think thinking about the crossover and as you said, the kind of intersectionality between brain health and various other policy areas is really critical to taking the agenda forward and giving it the prominence that it needs within political debate. I think is really important as well.
Okay, thank you very much. So I'll just read one of the questions from the chat box. This is from Maisara Isa. At the beginning, what are the simple steps for building relationships? Because really, advocacy requires building friendship, building relationship, so that people have a shared vision, they have a shared sense of mission and passion with you. And when all these coincide, then they are able to devote their resources to ensure that you are really able to achieve your goal, which is to protect everybody's brain health, including that of even the policymaker. So the question here is, at the beginning, what are the simple steps for building relationships with stakeholders and policymakers, and what are the remedies to the possible obstacles that may come along the way? For instance, they may talk about competing interests or competing demands, or resources that are limited, either in terms of personnel or even in terms of financial resources. So what are the ways of dealing with this? Sam, you want to take that? Okay, Justin? Yeah.
Go for it, Tim.
I'm happy to start. Thank you, Justin. And thank you for the question. I think it's a really important question. So I think what I would say is bringing together all the different key stakeholders who have an interest in this area is really important. So as an alliance, what we do is we bring together patient groups, we bring together professional bodies, we bring together industry partners, and we bring together people affected by neurological conditions, and we work together to identify the kind of cross-cutting themes. What matters most, what kind of pan-neurological areas of focus. So I think building your coalition is really important. And I think start with those who are already like to be friendly to your cause. I think when it comes to speaking to policymakers and politicians, I think simplifying your message and your ask is really critical. I think I had some good advice that was assume the reading age of 14, particularly for politicians. So I think, I think translating what are inherently sometimes quite complex issues into simple language and tangible policy solutions is very important as well. I think developing and going with solutions rather than just problems is often much more welcome by politicians and decision makers than a list of things that aren't working. Although it's much easier to do the latter, I think. So I think that's what I would say. I think thinking about building your coalition of people who are already friendly to your cause, thinking very critically about what your ask is in your message, simplifying that, and then going to decision makers and others with that message and with that ask.
Yeah. Do you want to contribute to that, Justin?
So I fully agree with Sam's thoughts. The other thing I would say is, depending on the government structure of your country, it may be challenging to get in front of actual policymakers, members of parliament, and so forth. But don't underestimate the critical value of the staff who work in those offices, who are sometimes making just as much in terms of policy decisions along the way as the actual member of parliament. So getting to meet with staff can be absolutely critical and a way to get your voice in there. And if you're not able to do that, think in your more local network. Who do you have easier access to who may have access there? So maybe that's your hospital administrator who is in contact with the Ministry of Health. Maybe that's your governor, your city's mayor or governor who has access to a larger body of other rule makers. So I think working your way through a network is critical. Dr. Tamborska also mentioned a really helpful toolkit that the American Academy of Neurology has put out on advocacy and speaking with policymakers. The URL is in the chat. the European Academy of Neurology has also put out a few videos on this in recent months as well, on how to engage with policymakers. So there's some great tools online to help you with that. And the last thing I would say, sorry, is social media is really helpful as well. So your policymakers are on X, they're on LinkedIn, you know, probably X or Twitter, as we used to call it, and you can sometimes access them through those means as well, politely, respectfully, not too often, but that's another way to get attention.
Absolutely. Actually, that was the point I was going to quickly make, you know, about the power of the social media. And if you have very powerful messages, either in writing or sometimes in pictures, because pictures tend to catch attention. A picture speaks more than 1,000 words. If the main thing you want to do, if you can represent it in the form of a figure, a picture, or a skit or a video, it tends to go viral and get a lot of attention. And so that's one of the ways of, and of course, as has been mentioned, you have to speak their language. Then you have to let them see what is in it for them, for the individual person. And for brain health, it shouldn't be too difficult, because brain health, everybody has a brain. So brain health is important to everyone. So following quickly on the heels of that is a question from Francis Mary Japitana. And this is from Philippines, with several problems in every country, you know, internationally, hunger, war, violence, and all of that. How do we really advocate for brain health to be prioritized? Because that's actually one of the key objectives of the WHO Intersectoral Global Action Plan against epilepsy under neurological condition, is to make sure that brain health is prioritized. How do we really make sure that brain health is prioritized by all countries?
I'm happy to start. I think this is such a critical question, and is unique to every situation. This reflects back on what I had talked about, the political and economic realities of a given location at a given time. And so when you're identifying what aspect of brain health you want to focus in on, stakeholders are going to be important. You may not be able to take on all of brain health. You may want to focus on a particular aspect and identify those stakeholders. And if your federal government is involved in war actively, you know, it may be hard to get that initial buy-in. And so again, starting at a regional level in ways to build momentum and build data, and then take that for the cost-benefit analysis to larger bodies, I think is going to be a critical stepping stone given other political realities at the moment.
Sam, do you have any comment on this?
I would echo what Justin said. I think it's a really important question, and I think there was a really thorough answer. I think that point about levels of engagement is really critical, and thinking about what you can achieve at levels other than the national level, particularly if there are significant challenges in a particular country. So yeah, thinking about, for instance, how you can, you know, at a local council, for instance, or a particular local health system or a regional health system, and then again building that evidence base and working with key stakeholders to develop that case for change, I think is really important.
And I actually might just add one more thing, if that's okay, is policymakers are an essential or a critical component, but you can make important improvements in brain health even without new laws and new policies. And so the value of NGOs and volunteer organizations really can't be overexpressed. And so if it's not the time for your government to focus in on this, there are probably many organizations happening in that stakeholder arena. And when you think on public education campaigns for stroke prevention, for all of these types of things, you can make huge differences in the population without actually passing laws. And that may be a way to lean in when the government isn't able to pay attention to your particular focus right now as well.
Absolutely. And that's why it's important to engage the entire spectrum of the stakeholder ecosystem. I mean, I showed that at the beginning. It's the entire spectrum. And a lot can be done even by engaging the populace directly, sometimes even through social media, educating them on healthy lifestyles, on what to do, how to identify stroke, where to go, and things like that. A lot really can be achieved through that. Thank you very much. So they really want you to reveal one secret to all of us. Sam, how did you manage to get the Neurological Alliance, to really engage with the UK Parliament, to align the findings of the survey you did and the economic report? And how did you manage to get their buy-in? We could learn from your model.
It's a very good question. I can't say that we have the level of buy-in that we would like yet, but it's an ongoing process. As I said, advocacy is a journey, and it's never really fully done. I think a couple of approaches that I would flag. One is that we put people affected by neurological conditions front and center of what we did, both through the patient experience data gathered through the survey, also co-designing and co-creating the campaign, and then similarly when it came to launch the campaign, as I said, ensuring that people's real life experiences and their stories were front and center of things such as our media efforts was really critical. Similarly, when it came to engaging with MPs, we had a method for people to invite their MPs along to meet with us. So rather than it coming from us as an organisation, it came from a constituent. So it came from a person within their constituency who, within a democracy, has a vote. So there is always an implicit, a bigger reason, more of a purpose for that MP to come and attend. And I'd say finally, we're an alliance, so collaboration is critical to what we do. I think it's also critical to advocacy more broadly. So we're stronger together. I think bringing together, key audiences with people affected by neurological conditions at the heart of it, and supported by good data and evidence, both economic and also patient experience insights, is really important. A collaboration around those things is what managed to deliver.
Okay. Thank you very much. I think I'll just take one more question, then we'll try to wrap up. So this is from Francis from Kenya, and was wondering what the impact of the mental health and brain health status of caregivers of under 5. Some under 5, either even normal or those who have neurodevelopmental issues. What is the impact of the mental status of the caregivers on those child while they are developing? And also mention that those caregivers might also be taking care of the parents too. And so the brain health of caregivers, how does it affect the family, including the parents as well as the young children under 5 that have neurodevelopmental challenges? Justin, you want to take that?
Sure. I think that this question is so critical and really highlights the cascade of potential benefit for a large-scale focus on brain health, because the individuals, more than 1 in 3 people in the world are directly impacted by brain health, but their ecosystem of caregivers is also impacted. So truly, probably everybody in this world is impacted in one way or another by brain health or brain-related disease. And I think that when Sam's discussion about bringing individual stories is so critical. The member of parliament that you're talking to is probably not a neurologist. They may not have really any expertise in healthcare at all. And so the data that we present to back our policy suggestions and goals is important, but it may not translate to any real world experience that your member of parliament has. And so when a caregiver and a patient are able to tell their story in a meaningful way, it catches attention so incredibly well with lawmakers and policymakers. And I think that those stories are just as important in many cases as to how the neurologic disease has impacted the whole family.
Thank you very much. Do you have any other final comments, Justin and Sam, so that before I quickly wrap up and then give it back to Arina?
I think the last thing that I would say is everybody on this call, first of all, thank you so much for joining. I think we all have tremendous capacity to speak up for brain health, to speak up for the whole world who desperately is in need of attention to keep us all healthy and doing our very best as long as possible. And so hopefully this was helpful. I would be delighted to engage further if I can help in any way in terms of advocacy efforts. I think that we all have capacity to do great things. So thank you.
Thank you very much, Sam. 1 minute.
Yeah, no problem. It's been a real pleasure to engage with colleagues internationally today. It's not something that I get to do as often as I would like. So thank you so much for your time and for your questions and for your engagement. Similarly, like Justin said, if there's anything that we can do to support, we'd be delighted to do so. Purely sharing the resources and the work that we've done to see how it might be applicable to support the work you do in your own countries. And yeah, really delighted to be able to speak with you today. Thank you.
Thank you very much. So let me just summarize the key points. Brain health is important to every living human being. We can't dispute that. We do not only want to preserve it and prevent dementia, we also want to promote brain health. So, and that's very critical. 1 out of every 3 people is at lifetime risk of neurological condition. Neurological conditions are the leading causes of disability and death globally. So it deserves attention. Well, and this attention has to go across all the 4 pillars of the brain quadrangle in terms of surveillance and data, which is what helps to drive policy change and interventions in terms of promotion, in terms of acute care, in terms of rehabilitation and recovery. Now, the advocacy journey is not a straight line. It's not linear, and there are many hurdles to cross, a lot of contextual issues that needs to be addressed. The entire ecosystem needs to be engaged in our spheres and zones of influence. We need to use different types of approaches and channels to communicate. It could be social media, it could be policy briefs, it could be having an economic case, a convincing and compelling economic case, or a political argument, that will help to get buy-in from all stakeholders. And sometimes it's not just only the policymakers, it's a multi-sectoral thing, and we need to engage everybody, including the general populace, including caregivers, including physicians, including patients, and including those at risk of different conditions. And then using simple language with very clear message, and then using social media and different modes of communication, including even home videos, including screenplay, including applied theater. The point is we want people to share the vision and get that passion, a sense of mission, and be ready to invest, because at the end of the day, everybody is all the better for it. Once you deal with brain health and brain health is solid for everyone, then physical health, which because our brain determines sometimes our behavior, isn't it? And so we're able to protect our physical health as well as our mental health, as well as the social health, as well as the planetary health. And the planet is all the better for it, and we are all the better for it, the entirety of society. So thank you so much thank you so very much for this opportunity, Justin from the AAN and Sam from the UK.
Thank you very much.
Arina, over to you.
Thank you very much. Thank you to our speakers, and thank you for our chair and to our audience for engaging discussions. I think the summary is that this is, not a simple solution, not sort of a step-after-step recipe, but a complex process. But the more of us we have on board, the more we can achieve. So thank you, everyone, today for joining. Now, with just a couple of minutes left, the exciting section is about opportunities, and we have some important announcements to make today. So first of all, we are announcing today that we will be pausing our clinical exchange platforms from July. So July will be our last session in this series. We have been live for over 3 years. We started in the COVID pandemic together with the Brain Health Unit at the WHO, first to exchange the clinical knowledge about the COVID infection and neurological complications of it, which was a new state of the world at that time. And we've built a platform combining expertise and knowledge of multiple clinicians, researchers, and members of the public as well over the last 3 years. So we're really grateful for the community. To summarize everything that we've been talking about, and particularly the fact that we've transitioned to then speak more about the ways to increase global neurological capacity worldwide and support IGAP, we are having an exciting announcement, and we are organizing a competition. So to our all audiences and everyone who participates in our seminars, we extend an invitation to submit a brief video about a solution or an intervention, even something that is still in progress that you are planning to do, on how you are trying to improve care or capacity for neurological disorders and patients with neurological diseases in your setting. This is open to participants all over the world, particularly from low and middle income countries. And we are inviting a 3 to 5 minutes video submissions which will not be based, sort of judged based on the cinematographic skills, so we don't need any sort of professional filmmaking skills, but just on the content and on the intervention that this presents. We'll be opening the submissions now, and they will be until the 30th of June. And the exciting thing is that the winner will receive a prize of sort of total value of $1,400, which will include the cost of registration for the University of Liverpool well-established and running for multiple years neurological infectious diseases course, and as well as the cost of travel to Liverpool. So there will be a bursary towards offsetting this cost of over $800. So we are open for submissions. We don't have much time, so I'm not going to go through all the requirements for the videos and all the guidelines, but please do scan the QR code. There should be also a link popping out in the chat, and do spread the message, share it with your colleagues. And you can retrospectively watch our platforms and see how an intervention that you've been working on to implement can connect to those. I'll be delighted to get your submission. We'll announce the winner at the last clinical exchange platform in July, so keep an eye out for that. Second, WHO is running a public consultation on the diagnostics of Alzheimer's disease. This is open to all members of the public, and not only those who are affected by dementia. And this is open to the 10th of May. And you can scan the QR code to provide an opinion to feed into actual policy making. So this is one way in which you can take simple steps as well today yourself, joining on this call, to actually contribute to policy making for neurological diseases. So an important consultation, and the link for that should be in the chat as well now. Next, we are also delighted to promote McDonald Fellowships, which are funded by Multiple Sclerosis International Federation. And these are open to researchers from low and middle income countries for 2 years research projects, which need sort of a host intervention, host institution application as well. So if you have a project that you've been working towards or an interest in multiple sclerosis research, you can approach institutions based in the UK, and you can co-apply together to be funded. There is a salary and research cost covered, and it's an excellent fellowship, and we should be having a link in the chat as well, and you can apply for that until the 30th of June. And then we have launched our website, so we are combining all the resources that we developed in this process of the clinical exchange platforms, as well as some of the other research on brain infections, which was coined by our team here in Liverpool. And you can register on our website to access those resources and stay connected in that way to the community, even when we put the clinical exchange platforms on hold. And within that, I want to invite you to the next session, which will be, I'm just sorry, skipping the slides, on the microbiological diagnosis of brain infections on the 31st of May, 2024. And we'll have speakers from India, and also our chair will be talking about research project that was carried out in Brazil, Malawi, and India as well. So we hope you can join us for that. We hope to get your submissions for the Global Change American competition. The prize, I think, is excellent. It's a great course in Liverpool. And stay connected, join our network, and please advocate for neurological disease in your settings. So thank you very much for joining today. So this is the end of the session, and yes, you can now plug out. Thank you.